Today I'm delighted to have the opportunity to talk with Professor Gerd Burmester. Given the fact that the pandemic is still an issue in many countries, we will address the concerns that people with rheumatic and musculoskeletal diseases have in going back to their hospitals or clinics to resume their treatments. Thank you for joining us today, Professor. My first question to you is the following. Is it safe to go back to my regular medical appointments at the clinic?
So thank you very much for your invitation. Your health and safety are the top priority of your health professional, and that is why clinic visit guidelines have been updated around the COVID-19 situation with necessary precautions to provide the best possible care in a safe environment for everyone.
Can you tell us, Professor, how to best prepare for my medical appointment? And can my routine appointment be replaced by a video call?
So obviously, this is a very important question. And before you visit, make sure that you only come if you do not have an infection, if there is no cough or fever, so that you are not risking to infect other participants in a clinic. So also check with your doctor if your appointment can be performed via video call or any other alternative remote method, such as a telephone call, for instance. This could be an option if your last physical appointment was not long ago and your health situation is stable and you're well controlled. However, this is not advisable if the disease is not fully under control or in remission. And obviously, it is also important to take lab data to do lab monitoring if, for instance, you are on methotrexate and we need to control the whole blood count and also the liver and the kidney values. And when calling to book your physical appointment at the clinic, please notify the team if there are any changes to your health, as I just previously. Only come if you do not have signs of infections. And also make some notes that you are going to ask to the doctor so that you do not miss anything, that you go back and say, oh, I forgot to ask this question. So I think notes are always welcome, and write down your questions so that you can ask them. During your visit, please follow the recommendations by your clinic, doctor, or general practitioner. And let me just show you some of the measures followed, for example, at the Charité Clinic. So first of all, use of mask is mandated by all doctors and patients. So you should not come to our office without a mask. And also the doctors, the nurses, even the secretaries, and everyone is wearing a mask in the clinic. Disinfection is very important, and we have disinfection devices spread all over the offices and the examination rooms so that you can do a proper disinfection. Distance to the next patient or to the next person is very important. This should always be at least 1.5 meters. So you should not line up closely to the next patient. And whenever possible, and you do not need special assistance, please come alone so that the number of people at the hospital can be minimized. We also take great care that we always open the windows after a patient contact. So if there has been any virus in the air, it will be diluted out because there is some air coming into our offices and into the examination rooms.
Thank you, Professor, for your answer. Can you tell us which is the correct use of the masks and of washing our hands?
Yeah, that's of course very important, and I'll be happy to show it to you. First of all, I would like to point out that you should please follow the prevention measures by the World Health Organization or, of course, your national health authority, which usually includes the use of masks and frequently washing the hands. And when you wash your hands with soap, which is normally enough because the soap kills the virus as well, you have a little bit help, because if you sing the full song of Happy Birthday to you, it will be roughly 20 seconds, and that's what we recommend for washing your hands. And then, of course, it is very important that you wear your mask correctly. So let me show you how I do this. First of all, I take off my glasses here, and I wash my hands. They should be completely clean. Now I take the mask and put it above my nose. And what is very important, also adjust the little metal strip. If you have one, or if you have an everyday mask, of course you will not have it, but adjust it so that it's underneath your eyes. Because the virus enters the nose, and that's where it's replicating. So it's very important that the nose is also covered. What is not good is that, what you unfortunately see frequently, so that many people wear the mask like this because they think the mouth is most important, but that's not true. This is the correct way to really take on the mask. When you take it off because you are in a safe environment, or you like to drink or eat something, also wash your hands again and carefully take off the mask. Okay, and then put it with a surface down on a clean desk, for instance, or a clean surface. So these are very easy measures, but they're quite important in dealing with a mask.
Thank you very much, Professor, for your time and for the useful information provided for us.
And I would also like to thank you very much for your attention.